right. So tips and tricks. People, they roll their eyes when I say this. I'm sorry. We are insuring a human body. If you're insuring your car, you're going to be sure you don't run into things with it, right? You're going to be sure that you change the oil. You're going to be sure that you take it in for maintenance. Your body's the same way. Let's treat our bodies as well as we treat our cars, okay? Get and stay healthy as much as you can, right? Because I promise you, I work a whole lot with the Medicare population. They are all wishing that they were on all generic drugs when Part D kicks in, okay? You definitely want to take care of yourself. The healthier you are, the less you're going to need, the less of an issue it's going to be for your health and for affording your health insurance. There might not be medical questions, but that doesn't mean you're not expensive, okay? Manage your drug costs. If you end up on a plan where they don't offer a whole lot of drug coverage, remember, generics as often as you can. If there's something that's over the counter, try over the counter first. I love GoodRx. It's a little app, blah, blah, blah. Put your zip code in, look up the drug. You'd be surprised what a difference the retail cost of a drug is between Walmart and a CVS or a Walgreens. And it's not always predictable. You never know who's got the right contract with the right pharmaceutical company, right? Check out GoodRx. Also generics. And did I say generics? I'm going to keep saying it. Generics, it makes a big difference. Once you hit a brand name drug, boy, the price skyrockets. Here's another novel idea that we are very protected from. Shop for your medical care. Do not assume that where you're going is the cheapest place, especially if you have a high deductible health plan where you have to come out of pocket first. If your doctor tells you to go up there and get an MRI there at the hospital, you go find a radiology facility outside of that hospital. For those of you in North Carolina, here's just an example. You got Awake Med, which is a big hospital system, versus Wake Radiology. Huge difference between what you're going to pay for an MRI, which is deductible worthy at a hospital, versus what you're going to pay outside of a hospital. Sleep studies are notorious for this. Don't do a sleep study in a hospital. Do a sleep study at an outpatient place. Shop for your health care. Ask the question. Get online. You go on Amazon right now to find the cheapest, I don't know, iPad. Why would you not do that for an MRI? You need to do it for an MRI too. Finally, and maybe I'm a little biased on this, find a broker to help you navigate the complexities of the ACA plans. Don't pick an ACA plan or any plan that you don't understand how it works. They have all these great documents you can download and read, but if you're reading and it looks like Greek and you're not Greek, you may want to ask somebody to help you understand it. And you know what? There's a lot of folks out there that'll do it, and they'll do it. We get paid by the health plan typically. There's no cost to asking our help and our advice. And there's a lot of us out there that we just want to help. So look for the helpers. They are absolutely out there. Don't buy something you don't know what you're getting. So here comes the fun part, the gifts I'm giving you for Christmas. Links and resources, okay? ACA plans, healthcare.gov. All right, that's a no-brainer. You know how to get to this. Here's that Health Sherpa link. Again, it's just a little bit easier to navigate, and it works directly with healthcare.gov. So it's a worth look. Short-term medical plans. I provide here the ones through United Healthcare. They're the ones I'm the most familiar with. There are others, but I've had good experience with these. Individual dental, critical illness, accident insurance plans. Again, this is a United link, but again, a lot of times you can find these things in your local state with even maybe a local blue plan that has some ancillaries. Always take a look. Here's that medical cost sharing ministry I was telling you about. Here's my pro article, and here's my con article, okay? I just feel like it needs to be seen from both sides. And then the top three that are out there, MediShare, Christian Health Share Ministries, and Liberty Health Share. Again, I will say that the people who have been on them have had generally positive experiences, but take a look at the con article as well, so you can kind of get a real good picture on this. Term life. Honestly, there's a couple of them out there right now. You can find them if you're on Facebook at all. I'm probably aging myself. You guys are probably way cooler than that. But, you see Ethos all the time. It absolutely is life insurance. Go look at it, quote it, get it, type it in. It's not hard to do. You don't need an agent for that. And here is a place for a disability. for a disability quote. If you were looking, you may have health questions. They may have to, come into your height and weight and stuff. Just know that that's potential there.